the opportunity to deliver both drugs but also healthcare based around individuals will be incredible, and the impact could be huge. Whether the NHS can deliver it in that personalised way, I think will need a lot more effort and funding on their part, but for better health outcomes and reward at the end.
The optimist in me is excited because actually the one-size-fits-all approach doesn't work in health, and we have different people who present in different ways and who discuss and talk about their healthcare challenges in very different ways, and individualised healthcare will allow us to be able to see that, whether we're looking at the way people talk about their health problems, the way the health problems might appear on their skin, if they've got different skin tones, if it's rashes, we can start to look at that in a more objective way.
Healthcare data has been personalised data has been long been shown to be useful for patients, particularly as a GP. We use things such as the QRisk calculator for cardiovascular risk and also for cancer, and that can give patients a personalised result, and it gives them a bit of a context to frame their risk.
If organisations that have access to personal data, if they can do primary formative research to understand what the problem is, then that data can be used in a much more effective way.
The flip side of that is why have I got a bit of pessimism? I think it comes down to the fact of who owns our data, what's going to happen to it. I think the public are worried that data can be sold on, potentially rightly so. I mean, if you think about the NHS, I think it's 65 million patient records. It's a huge data mine for machine learning, so lots of organisations are interested in it.
Often humans hold biases, and humans and individuals are the people who are creating the algorithms and are creating the systems to then start to predict and start to prescribe these digital tools. So it's really important that we don't just mimic what we're doing offline, and we hold those same biases online as well.
I think it was last year, there was the Royal Free Hospital where Google DeepMind obtained a lot of patient details, over 1 million, and there was a lot of controversy surrounding that. So I think the public are kind of rightly concerned about that. I think if they can earn trust and do it in a transparent way, overall I'm optimistic, and I think technology and healthcare has got a lot that I can collaborate in together.